Just as a reminder to all of our attendees, we cannot see you. So if you have any questions or comments throughout our presentation today, please feel free to put those into the chat box or the Q&A, and we will be getting to all questions at the end, as well as addressing any comments that you guys have. Also feel free to raise your hand at the end and we can allow you to talk if time allows. So at this time, again, we welcome you this afternoon, and I'm going to turn it over to Lenora for just a few moments.
Wonderful. Good afternoon, everyone. My name is Lenora Walker, and I'm a care consultant for PSS Kinship Caregivers Program. The program is stationed in the Grandparent Family Apartment Building, known as GFA, in the Bronx. The building is owned by PSS. It's the first building ever built for kinship caregivers and their families. It was built back in 2005. Our kinship caregivers are seniors caring for grandchildren who are not biologically their own, but are blood related. So it could be a grandmother, a grandfather, an aunt, or uncle, or a cousin. The services provided to kinship families are our youth and young adult services, which we offer an after-school program and a summer program for children ages 6 to 18 years old. We assist with educational support and college and job readiness. For our care givers, we provide, support group, health and wellness training, social activities, one-on-one family counseling. We do have respite service and supplemental services. All of our services are free of charge. If you know someone that is interested in our services or interested in living in our grandparent family apartment building, please contact me at 917-734-8431, or you can email me at lwalker@pssusa.org. Thank you, everyone, for your time, and have an amazing day.
Thank you, Lenora. All right, everyone, at this time, I have the pleasure to turn it over to Natalie and Megan, who are going to be presenting for us this afternoon. Again, if you have any questions or comments throughout their presentation, please feel free to put those in the chat or Q&A, and we will address all of those at the end.
Hi, everyone. I'm Megan Lupkin, and Natalie Meslumi, who you will see quickly. We're from In-Care Home Care. We're a home care agency. And today, it's a big topic. As we all think about aging at whatever stage you're at, I think people think of it, maybe get documents together and it's done. And some don't, because it's a hard topic. But deciding how you want to age and where you want to age is something we don't think about a lot. So our objective today is to give you a sense, whereas some people go to assisted living or nursing homes, the other choice is to age in place at home. Next. Just to give a little levity to the situation, as we all age, you have to remember we're seniors, but so what? As Betty White says, I'm still hot at the ripe age of 99. I could be wrong. Next. The big thing when you're starting out, as I said, a lot of people don't want to even think about it, but it makes life so much easy to make a few decisions before your time comes. A lot of people do this as they're, in their 50s, some do it in their 40s, and some do it in their 70s. But a care at home is a decision. All of this is not planned. So much can be dictated by an accident. But if you have certain key documents in place, it just makes it easy. So if it is an accident, then you're not scattered all over and there's a little less tension because everything's laid out. And the three documents you would want to have are your power of attorney, which will give someone the right to sign checks for you, get involved with your money and making situations about that. Your healthcare proxy, which will give somebody the right, if you are very ill and incapacitated, they will be able to make decisions and sign documents, and the doctors will be able to disclose the information to them. And many times this is, with all of these, it can either be a relative or someone you feel safe with. And lastly is a DNR and living will. And this is something that's even hard, but I think some people have had experience, so they base it on their experience. Do you want to live in a certain state? If somebody needs to be, who's 90, needs to be resuscitated in an ambulance because their heart stopped, do you want that to happen with you? If your brain is no longer working, do you want a ventilator? Or decisions like that. When is the point, even with COVID, when you cross that line from a device helping you breathe, that you're actually breathing somewhat or going on a ventilator? Is that when you want to stop? And that's all advanced directives called a DNR, do not resuscitate, and a living will, getting a sense of what you want. So it's in your hands to make that decision. And sometimes it makes it much easier for other people, you know, who might, your children might have to make that decision, and it's just so much easier. And I think the bottom line is planning is key. It just helps to have everything, so when the situation strikes, no one is fumbling. Next. As we're talking about aging in place is one, alternative. First of all, you're seeing record growth. People are, from the scientific breakthroughs to taking care of yourself, people are living much older. And you're seeing at this point, 47 million seniors 65 plus. By 2060, that'll be 100 million. But if you look at it, who are the seniors who are receiving care in home and want to stay in their home? And who are the seniors who decide that they'd rather live in a community outside their home with certain support? We're seeing at this point, it's incredible, 87% of seniors in the US are receiving the care at home. And this will grow by 19% by 2030. And I think it's all hard because, many moons ago, there was the extended family where you could just age in place and so many members of your family would take care of you. And now that's not the case. And when you look at home health care spending, which is quite expensive, spending has increased by 30% in the last 5 years. And they're saying there will be 187 billion spent by 2027. It's incredible. And, the need for the care has escalated and the cost for care keeps growing and growing. Next. So as we're talking about aging in home, and I'm sure a lot of you have these feelings, period, that I never want to leave my home. You're going to have to get me out of here when I'm rolled out of here, excuse me, because you love your home. You've spent your whole life building your home. So what are those benefits to all of us? The freedom to do, and the real independence that someone else isn't telling you when to eat, when to get taken care of, when you have to go to bed, when there's an activity. Instead, you're determining that. And you have a sense of privacy. You don't have to have interaction if you don't. You love your home and enjoying the comforts of your home. You have many friends and family that don't want to be restricted to visitation when you can see them. And the other thing, when it gets down to care and what type of structure you'd like to have to take care of you, which does change at different points, there's the ability to customize your care plan and change it all the way. There's some incredible benefits they've seen from aging in home. 50% less doctor visits, so people are going much less often. Increased longevity, so increasing the years you will live. And another one, which is quite prevalent, is there's less advancement of memory loss, which shows what the home can do for you as you age. Next. The right time. It's funny. I think people always think, well, I'll know the right time when, I need to get some care in place. It'll be simple. This will happen to me. But at the same time, oh, I'm sorry. There's no clear delineation because sometimes it's so, it's just feeling like it or trying to be logical about it. But unfortunately, there isn't a guidebook. And I think what you really have to consider is, are you compromising my safe, healthy health and self-care? So if you want to determine what the specifics of that are, you're declining in personal hygiene. It's just too hard for yourself to bathe, to take care of yourself in the right way, and you're not looking like the person you were. Then you have certain health conditions, maybe it's diabetes, health disease that you're seeing worsening, or you've developed a new condition which is chronic and requires care. It's too hard for you to have fresh food in the house. So what are you going to eat will become a decision for you. And then, home is unsanitary. We all love to keep a lot of things around, and the older you are, the more cluttered it gets. And I think, you might be feeling isolated, if you don't have certain family members, and it's harder for you to, get outside, and that can lead to real loneliness and depression. Next. That's when it's the best time to really have an evaluation, which is called a professional geriatric assessment. And that is something that it's really looking at your physical health. It's also looking at cognition and your overall mental health. So looking at, how sharp you are and how you feel. And it's also the environment you're in. Is that going to be conducive to aging? And the best people to do it are the social workers. And that's where PSS is great because they have everyone on staff and the specific social workers who work with communities who can go in and make that assessment. And what goes behind that assessment, you're looking at nutrition, you're looking at somebody's vision, you're looking at their hearing. These are all things that make it very hard to live without some support, whether they're incontinent and their overall balance, which can lead to falls, which can be a big problem as you age. So the thing where a professional assessment goes, it really brings a care plan together. So this will give you the outline of how you coordinate and manage care, and the social worker will be instrumental. and the evaluation of what exact care you need. And bottom line is, the objective is to really strengthen your functionality so there is a great quality of life moving forward. Next, and I'm going to introduce Natalie Maslumi, and she's the director of In-Care Home Care. And take it away.
Thank you so much, Megan. So as Megan said, you know, the importance of having an assessment to have a professional help you put together a plan of care. When that assessment is completed and you have a plan of care, the care is really broken up into two separate categories. There's unskilled care and there's skilled care. And this list that we're looking right now are some of the examples of unskilled care. And in the States, we call it the activities of daily living. Somebody who needs help with grooming, bathing, dressing, feeding, toileting, transferring, continence, light housekeeping, laundry, meal preparation, medication reminders, shopping and errands. This is what is categorized as unskilled care. And a care plan should put together the activities of daily living that you and any individual needs help with. And this care plan will evolve over time because as time goes by, your needs will change. Next. This list is a list of the skilled services. So, you know, the previous slide just outlined the non-skilled services that anybody needs would need to keep safe at home. And these are just examples of skilled services that an individual may need in their home to safely age in place. Visiting nurses, medication setup, medication administration, insulin, wound care, catheter care, hospice support. There are agencies and providers that are licensed in New York to provide skilled care. And when you put together a plan of care, a social worker and a care coordinator would be able to delegate and say which of these services are to be provided by a caregiver or home attendant, and which of these services legally have to be provided by an RN, by a CNA, etc. Next. Modifications to home. Of course, when you want to age in place, you have to consider the changes that may be necessary to keep your home safe. There are routine evaluations done to make sure that an individual can bathe at home safely. You know, in many instances, grab bars are installed to make sure that somebody could get in the shower and get out of the shower. The bedroom is evaluated to make sure that there's no carpet that is a trip hazard, that there's no wires or cords, that there's bed rails on the bed or a hospital bed. We you know, it's also important to evaluate the access to alert a medical EMS or doctor, and there's technology right now that makes that even better and even safer. You know, certain things in the kitchen have to be assessed. Sometimes, you know, a caregiver or a family will be alerted that an individual is misusing the gas stove, and certain changes have to be made to the kitchen and with the building to make sure that this resident is safe and to make sure that the neighbors are safe. And this all just comes under a plan of care. You know, having a professional assess your living situation and help make recommendations to keep you safer. Next. Medical services in the home. I think, like Megan says, moons ago, There were doctors and professionals that routinely came to the home to provide services. But for decades, this just stopped, and it just wasn't something available. But with the demand of in-home care comes the need to have these services provided in the home also. So there are a lot of providers, medical providers, that their business, their services are to come and the same for physical therapy, occupational therapy, nutritionists, social workers. There are a lot of these services where the model is changing and they're being provided in the home. You know, we also see an increase of dentistry, something that we never thought could be done in the home. X-rays, audiologists. You know, there are individuals, seniors that need help with their hearing devices, but the idea to go out of their home to fix their hearing aid just has so many steps and is so prohibitive that they go without addressing the issue. But there are services that we're so fortunate enough to have in New York that brings these services to the home. Next. Cost implications. This is perhaps the biggest topic. As Megan said earlier, the need for care at home is increasing, the aging population is increasing, but the cost of care is also increasing. And our goal is to be a resource and to educate individuals on the implications and what's available, and to educate and so that people are more familiar with what is available and who is responsible for care. This is for long-term care. So Medicare, contrary to popular belief, does not cover long-term care. It does, on some instances, cover home care. If you're discharged from a hospital or rehab, it's for a very short time. It's not very comprehensive, but it is available, and some people have to tap into the home care that Medicare provides after a hospital stay for 2 or 3 weeks to supplement the care that they have, because the whole goal is, you know, the care is so costly. How do we piece it together, and how do we make sure that we are connecting with every resource that's available? For those who are fortunate enough to have a long-term care insurance, these are policies that provide payment for home care. We see a trend where the policies, if it was 10 years ago, may have been comprehensive enough, but as the cost of care increases, we see that the care that these policies cover is not enough. You know, therefore, just adding to how important it is to plan and make sure that you're tapping into different resources. There are many catastrophic policies that pay for home care for a short time after a catastrophic incident. It's funny, there are a lot of people who don't know that they have a catastrophic policy. And I think that part of your planning really should assess and include whether or not you have this catastrophic policy, because somebody that is going to help you when you have an accident or there's a catastrophe has to know what policies and what resources to tap into. Union, there are a lot of benefits that, for example, UFT, the teacher union, and other unions provide to their aging members. And it's also important to inquire and find out what benefits you may be eligible for if you are a union member. The same goes for veterans benefits. They have a lot of benefits a lot of resources, a lot of tools, a lot of professionals that can help and help an individual navigate this long-term care process. A big item on this list is community Medicaid, which we'll go into in more detail in the next 2 slides. And then there's grants, caregiver grants. PSS, for example, has a program for respite grants. It is not long-term, but it does address, the need for caregivers, family members, to have respite care. And this does fill in one of the gaps that many people face when they are trying to piece together their long-term care planning. Next. Setting up and implementing care. The continuum of care is quite fragmented, but it's really maybe 3 or 4 main categories. Of course, there's private pay. And what does that mean? That you're paying out of pocket, either A, through a home health care agency, where you pay an agency to staff and provide caregivers that come and work for you. Usually this care is set up hourly. You can say I need 4 hours of care a day, 5 hours of care a day, and the agency is involved with the coordination of care and to make sure that it follows the care plan that you have in mind. The agencies charge an hourly fee for this care. And if somebody needs 24-hour care, there is this concept in New York that in lieu of having 2 12-hour shifts, if you just need supervision in the home, but the active care is during the day, you may qualify for live-in care, which is a little bit more, it's less cost prohibitive than 24 hours of private care, of home care. There are also many directories of caregivers in New York, and it's a different model than home care agencies. With a home care agency, you're paying an agency to be the medium and to coordinate and to navigate. But you are paying a premium for that agency to provide that service. An alternative, and sometimes it's cheaper and more cost effective, is to work with a directory where you can choose your own caregiver, and then you have a independent payment structure with them. These directories also have skilled services, which is a little bit different than what home health care agencies in New York are allowed to do. Most home care agencies in New York, the licensed home care agencies, only provide personal care assistant and home health attendants. They don't have the license to provide the skilled need. So these directories of caregivers fill in that gap because you do have access to a CNA or an RN that can help you with your skilled needs. Like I mentioned before, long-term care insurance is a private policy that you're paying towards all these years, and it covers your home care, your long-term care. Long-term care insurances like John Hancock, MetLife, Genworth, they typically have 2 options. Option is A is that you work with a home care agency, and the home health care agency bills a long-term care insurance and pays the agency directly. The alternative is if you do have an independent caregiver, let's say you have a caregiver that you hired from a directory and they're licensed, and you do have the option with many long-term care insurances to pay this independent caregiver directly, and then your insurance reimburses you. Every insurance has a different policy, a different setup. So part of your assessment and your long-term care planning should assess which option would work best for you and which would be the easiest for you to manage. Next. This is a big topic, setting up and implementing care. In New York, community Medicaid is one of the biggest long-term care payers. The Medicaid program for home care mentioned on the slide, Medicaid is a primary payer across the state for long-term care. But since the Medicaid is a mean-based state and federal program, there are certain eligibility requirements that must be met in order to qualify. I can't stress enough how important it is to inquire and become familiar with community Medicaid. We've seen so many individuals who didn't think that they would need to plan for Medicaid and had a long-term care policy or were paying privately. But unfortunately, or fortunately, they outlived their savings and what their long-term care policies were providing, and they had to plan for Medicaid. There are many professionals, there are many resources that specialize in assisting people navigating the complex Medicaid process. There is not only a financial requirement to become eligible, but there's also a medical one. And I know that PSS facilitates and helps advocate. There are many attorneys who specialize in this area of law. And it's always good to inquire about it because you know, there are a lot of false assumptions and there are a lot of rumors. You know, we've seen that a lot of people were successful in transitioning to Medicaid, but they did need the help of a professional or of an organization to enroll in the program. So when somebody qualifies for community Medicaid and becomes eligible, what's the next step? They enroll with a managed long-term care. It's called an MLTC. And in New York, there are about 10 of them. And these are insurance plans that they streamline the delivery of the services that community Medicaid authorized to the individual members. And the MLTC, these insurance companies, they determine and approve the care hours. And they say, for example, at this time, you are eligible for 7 days of care, 4 hours, or 7 days of care, 5 hours. And then they authorize a licensed home care agency to provide the care. The question that we see, and I bring it up because it's so important, what if this care that I'm approved for is not enough? That's why it's so important, and we can't stress enough the importance of working with an organization like PSS, with a social worker, with a care manager, with an attorney who can help oversee these steps and help advocate. It's a blessing that we have this as an option to pay for very costly care, but it does require a lot of planning and a lot of organization to make sure that everything falls into place. Next. The benefits of working with a home healthcare agency. So as I just mentioned in the previous slide, when somebody enrolls for community Medicaid, which is the in-home healthcare, Medicaid gives the MLTC, this insurance company that you're enrolled with, the authorization to have a licensed home care agency provide the care. So Medicaid directly doesn't allow you to hire your independent caregiver and reimburse you. It has to go through a home health care agency. And if you're familiar with the CDPAP program, CDPAP is the Consumer Direct program where, let's say I want my niece or my sister to be my caregiver, and I'm part of the Medicaid system. I can have the agency hire my sister, my niece, as my caregiver and get paid instead of a licensed caregiver that the agency would supply. But the agencies are all involved, and their role is to do the legwork. They have to plan the care. They have to coordinate the care. They have to vet, recruit and vet the caregivers, train the caregivers, do background checks, confirm the credentials. And a big part of it is, you know, caregivers need as much support as clients do. And the responsibility falls on a licensed home care agency that's hired by Medicaid to manage the finances and make sure that caregivers are getting paid on time, and to make sure that they have their benefits in place. And this really takes the burden off the individual. So whether you are dabbling with private care or care through your long-term care policy or Medicaid, it's important to find a home health care agency that can act as your advocate. An agency also has a responsibility to select the appropriate caregiver and troubleshoot when there is a problem. Care evolves, the needs evolve, and you may have a wonderful caregiver, family member that was able to support you in the beginning, but as your needs change, you need a more extended care team. And that's really the role of a home care agency in this model in New York, in this Medicaid model, in this long-term care model. Next. Plan, plan, plan. Everything is easier when you plan ahead of time. It's not easy. I don't think anybody, we are in a line of work where people, like Megan said, don't want to think about. But this is really, the message really is that the sooner you plan, the more you have control, and the more customized it can be. And, you know, you don't want to put yourself in a financially vulnerable situation when you are ill, nor do you want to put your loved ones in that position. So this is really a long-term care plan, we always say, is a life plan. It's just, how are we planning for this maybe very long stage of life? Next. This slide has my contact information. I provided my cell phone number and my email address. If anybody has inquiries, they're encouraged to contact us directly. And Megan also provided her mobile number and email address. And I believe our presentation is complete, so we are ready to take any questions.
Great, thank you, Natalie, and thank you, Megan, for that really informative presentation. So at this time, does any of our audience have any questions or comments to make? I will read them aloud to Natalie and Megan. Or if you would like to raise your hand, we're happy to allow you to speak and ask them the question yourselves. Of course, if you don't want to ask right now or a little too shy to, that's certainly all right as well. I'm sure they would not mind for if you reached out to them directly. So feel free to do that as well. But we do have one question for you guys. Karen, I'm going to allow you to unmute yourself. So now you just have to unmute. Karen V, if you're able to unmute yourself, you'll be allowed to speak, unless you did not mean to raise your hand. All right, we're just gonna, okay, no problem, Karen. You don't have a mic. That is certainly all right. If you just want to type in your question, we're happy to read it aloud and answer it for you that way. While you're doing that, we do have one question for you guys. What is the cost of getting an assessment plan?
Natalie, are we unmuted?
Yes, y'all are in.
In terms of an assessment plan cost? Well, it's funny, many a times as PSS is really, since you guys are all involved, they have some great people there who can really do the assessment. They're trained social workers. So there is no cost involved. You have the resources right there to do, everything that needs to be done and set up a care plan as well. And an agency, if they're involved, they end up, when they first assess you, as to coming out with a final care plan as well.
Great, thank you, Megan. Another question. This person says, having a great deal of trouble moving people to managed long-term care from the marketplace. Any suggestions?
I don't know what the exact problem is. My recommendation would be that these MLTCs, these managed long-term care insurances, they have teams that are, their role is to help individuals who are prospective clients enroll with them. And they go very far and do a lot to help individuals navigate the system. Sometimes the transition doesn't go through seamlessly because the individual didn't have what's called a maximus assessment. So when you become financially eligible for community Medicaid, New York has to conduct what's called the maximus assessment, which is a telephonic assessment that makes sure that you are indeed in need and eligible for this home care at home. Sometimes when that maximus assessment isn't registered or didn't take place, the transition to an MLTC doesn't happen. So my suggestion number one is to reach out to these MLTCs because they have outreach programs that their role is to help people navigate the system. And if there is a problem with the code or the profile that Medicaid has, they would be able to advise and make recommendations. And also just to make sure that this maximus assessment, called the conflict-free something assessment, that it took place. Because an MLTC cannot enroll a member from the marketplace if Maximus didn't do their assessment. They need a Maximus approval in order to enroll a member.
They said, thank you very much for your help.
You're very welcome, Janet.
Great question, great answer. Do we have any other questions at this time? Again, we can't allow you guys to speak. So if you'd like to ask your question live, we're happy to do so, or feel free to chat as well if you're more comfortable that way. All right. So if we have no more questions, again, Natalie and Megan so kindly provided their contact. Oh, we do have one more question. Perfect. If a person lives at home and wants to receive Medicaid home care and the daughter owns half of the home, will Medicaid take part of home Medicaid?
So it's a great question. Thank you for asking. It requires the assistance of a skilled Medicaid attorney. It is possible, and many of our members did Medicaid planning and had their assets put in trust. But it's too big of a question for me to address, and I don't want to make any mistake. It is possible. There are so many legal solutions to qualify for Medicaid. The system is somewhat designed to, the system prefers that you stay in your home rather than for you to go into a nursing home. So there are a lot of solutions, a lot of legal solutions to make it happen. It's a whole separate topic, and I don't feel like I have the proper credentials to answer, but I would encourage you to speak to a Medicaid attorney and find out how it's possible.
My question, I'm unmuted. Madison, are there any attorneys that work with you guys who can answer those type of questions?
Certainly. So we have had elder care attorneys present webinars on general information when it comes to elder law. So we have lots of those in our archives on our YouTube channel. And we're also happy to provide some resources for individual elder care attorneys that you yourself could reach out to for those more specific questions. PSS is happy to help you do that. You can contact us directly and we can get you those resources. Great. All right. Another question. If the home is listed as JTWROS, so daughter to receive after death, would Medicaid take half of the home, or does JTRWS prevent this from happening?
Linda's asking some amazing questions. I think this is also a question that we should encourage her to ask a Medicaid attorney. I know PSS has the resources, and we're also happy to make the connection. But any legal advice is outside of our scope.
The only thing I would interject as well is, I think many a time people are really scared. I have a house to protect, or I have this to protect. And sometimes in working with a good attorney or a Medicaid planner, they can find different ways to handle that, which might not be even one answer. But that's the beauty, because these people, the elder care attorneys and Medicaid attorneys, are very skilled at this and constantly doing it. So if you have these things in mind, don't negate them, ask the question.
And I know that the legal requirements of financial eligibility for Medicaid, it keeps on evolving. Oh, Linda asked another question. What is the new July deadline? Linda may know more than we do, but as of now, the deadline is still July. Linda's referring to a look back period. So with community Medicaid, there used to be no look back period, which means if I transferred my home into a trust today, next month I would go and I would apply for Medicaid, and Medicaid is not looking back, so I'm not paying any penalty. For a nursing home, there was an extensive look back period. Last year, they introduced the law to include a look back period for Medicaid, for community Medicaid. But the deadline keeps on getting pushed back, and we don't know if they're changing it. But for now, I think there's this rush, there's almost this panic to get Medicaid eligibility as soon as possible to avoid any penalties and ramifications.
We're also talking as it keeps going on that this might be extended to September 1st. And yeah, it's revolving, but at the same point, because things are changing, you're better off getting the information sooner than later, and you have it at your fingertips right now.
The laws that are changing with Medicaid are just a testament to how important it is to plan ahead.
Then you might be able to protect an asset you have. Or if you have some savings.
New York is lucky to have community Medicaid as an option. It's just very difficult to navigate the system. We hope to be a resource at the care level and help introduce the idea that even with the care, people need to think about it and plan about it and talk about it ahead of time. The same goes with legal planning.
And Tally, yes, this will be able to be recorded, and you'll be able to find it on our resources page on our website or on our YouTube channel. This will be recorded and will be uploaded there, so you can go back and watch it if needed.
Linda asked a good question again.
Oh, I don't even see it. Where?
Linda asked, is there a good book discussing all these issues, including community Medicaid? There's no book about community Medicaid, I think, for the regular person, only because the laws are changing. But there is a group, I think it's called NILAG. They're advocates in this space, and they go to Albany and they advocate for New Yorkers on all issues related to long-term care. And I think that they have blog posts that they constantly update the public about the rules and the laws that are changing. It's very detailed, but Linda, you seem to know a lot. So you can go and Google NILAG. I think the attorney's name is Valerie Bogart, and she provides a lot of helpful information. And I think in terms of a book about long-term care, I think the discussion is starting. The boomers are going to enter the space, and home care is going to change a lot. And if there's no book out there, maybe I'll write one.
And the only other thing is to see whether it's PSS Circle of Care, or it could be New York Department of the Aging or something like that. Many a times, if you Google, there's a lot of, free programming about community Medicaid that a lawyer will walk you through. It could be through the government and the Department of Aging, or I don't know, maybe one of these lawyers that is involved with PSS does do some, lecturing as well.
NILAG is just a resource. It's NYLAG. I only provided it because Linda asked about, a book or a publication that has these changes. I know that a lot of attorneys and a lot of professionals in the field refer to their publications for more information. But I think even there's a disclaimer on that website that this is not legal advice, that they should still speak to a professional for legal information.
Or there's two other sources. If you have a local politician, they give, they happen to have, this is a very big topic. I know on the East Harlem or whatever, there's certain senior centers that might give it. So there also can be a wealth of information in terms of in your district just calling up and finding out, because a lot of times they have those, as well as hospitals sometimes have this, and really educating people about future, they have geriatric units or free programming for this.
Thank you, Megan. Does anyone have any other questions or concerns for Natalie or Megan this afternoon? You guys are asking great questions and they are doing a great job of answering those. So any final questions or comments? All right. And of course, if anything, oh, yes, we have one more question for you guys. What does NILAG stand for?
I should get paid by NILAG, right? NILAG is the New York Legal Assistance Group.
Oh, that makes sense. Yeah.
Great. Good questions, everyone. Any final questions or comments today? And of course, if anything pops up, you have Natalie and Megan's contact information, and I'm sure they're happy to help you guys with any of those others that you may have that come up at any time. Thank you guys so much for being here with us this afternoon. Natalie and Megan, anything you guys would like to say before we close out this afternoon?
Well, thank you very much for attending. And as you have our phone numbers, please call, because it is daunting, but you're very fortunate that you have great support systems within PSS and people who will find you the right support as well. Thank you so much. But bye, everybody.
Thank you, Madison. Everybody is encouraged to reach out if they have any questions, and we're very grateful to be given this platform and spread the message.
Great. Well, thank you so much, both of you. We are honored to have you this afternoon. Thank you for all of the wonderful information and for your time. We look forward to seeing you guys. Oh, I think we have another. Oh, Linda also said thank you. So thank you from our attendees as well. You guys asked wonderful questions. And Natalie, Megan, you guys were so amazing. So I thank you all so much for being here this afternoon. We look forward to hearing and seeing you guys again very soon. And I hope you all have a wonderful afternoon.
Thank you. Bye-bye.
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 Thanks, everyone. Have a great day.